Good afternoon, everyone. Today's session is going to be really helpful, and it's led by Dr. Usha, who's going to talk about HPV vaccine. So stick around until the end, and there will be a question answer session. So let's not keep you waiting any longer. Dr. Usha, you have the stage.
Thank you. Okay, coming to HPV vaccine. First of all, we need to know what is HPV. HPV is a viral infection. It's called human papilloma virus. It consists of around 200 strains of the virus, which we know, most of them we know about those. So, HPV infection is a sexually transmitted infection basically from direct skin to skin contact or some sexual intercourse. It can be caused. Almost 90% or majority of us, whoever has encountered started sexual activity would have HPV infection once in their lifetime at least. So almost 90% of them will eliminate the virus due to natural immune response. Very rarely, if they are immunocompromised, if the immunity is low, or if the HPV virus is not cleared from the tract, then probably they may have some HPV infections, genital warts, some cancers. So basically, HPV can infect both men and women. And what they can cause, some of the HPV viruses strains which we know are categorized into low risk and high risk. Low risk like genital warts, and high risk like cancers. So most importantly, we know regarding the cervical cancer. So cervical cancer, almost 9 out of 10 cervical cancers are caused because of HPV virus. Other than cervical cancer, it can cause cancer of the vulva, vagina, anus, penis in male, also head and neck cancers. It can also cause oropharyngeal cancers in the back of the throat, tonsils as well. So categorizing them into low risk and high risk will help us to deal further depending upon the screening methods and the vaccines. So what I would tell you is there are few risk factors which we have to watch out for. Rather, more than any risk factors, almost all of us are under risk because it's a sexually transmitted infection. All healthy people can have HPV virus in their body, so almost everybody can get. In that, there are few high risk conditions like early onset of sexual intercourse, cigarette smoking, low personal hygiene, and oral contraceptives taken over a long time. These are some of the risk factors for HPV virus contracting. And regarding carcinoma cervix, I just want, it is very essential for us to know regarding carcinoma cervix. Cervical carcinoma is increasing trend throughout the world. In India, it is the second most common cancer after breast cancer. Almost 130,000 people are getting infected with cervical cancer every year, and almost 70,000 deaths are occurring because of cervical cancer. Almost in our OPDs, whenever a patient comes and we diagnose them with cervical cancer, 75% of them are in the advanced stage. So that is a brief introduction into HPV, that is human papilloma virus, the disease that can cause, in whom it can cause, how it is caused. So how do we test for HPV? As I told you, it can happen in everybody, all healthy individuals as well. So HPV, there is a screening method. There are a number of HPV related cancers as I told, genital warts and cancers. But a screening method for a HPV related cancer is available only to a cancer cervix. So what is a screening method? A screening method is something where you diagnose the disease even before the onset of the symptoms. The main goal of this screening method is to look into the atypical cells, treat them appropriately before the precancerous lesion becomes cancerous. So testing can be done. In whom it can be done, how it is done, what are the methods, we have to know. So generally testing is done in all women above 21 years of age. According to American College, we still follow that. So about 21 years of age. Less than 21 years of age, there's no screening required. Above 21 years of age, all women as well as transgender men who have a cervix have to be screened every 3 years once with a pap smear. Pap smear is something which we can do in two methods. One is a conventional pap smear. Second thing is a liquid-based cytology. The method of collection of the swab is the same. So we can just look into the cervix. The gynecologist looks into the cervix, collects the cervical cells and sends it for testing. So when we send it for testing, the pap smear can depict if there is any atypical cells in the cervix, if there are any changes in the cervix going on, which could be caused because of the HPV virus. Second thing is pap smear with liquid-based cytology. Though the method of collection is the same, the testing will slightly vary. And an added advantage of liquid-based cytology is that the further testing, in case if there is any atypical cells seen on a smear with LBC, then the further testing with HPV can be done with the same sample, thereby cutting your cost for further sample collection. That is one thing. And who all can get screened? 21 to 65 years, up to 65 years, every 3 years with a pap smear, either by the conventional method or the lipid-based cytology. Or you can do a HPV DNA testing 5 years once. Since it is slightly expensive compared to that, in India, most of us follow pap smear once in 3 years at least. And another method is either you can do a pap smear along with the HPV co-testing once in 5 years. For women who are above 65 years, in case they are negative, last 3 smears are negative, then we can discontinue after 65 years for screening. In case the 2 smears of HPV testing are negative in them, even then we can stop screening them. Suppose 2 smears on HPV and 3 smears of pap smear are positive, then probably we may have to go for further testing. And testing, this is about the testing, the age group, then how we go about it, the methods of testing. Next. Next question, please. Okay. So basically on a pap smear, we are looking at the atypical cells which are abnormal. And a HPV will detect the HPV virus in the testing. That's the difference between a pap smear and a HPV testing. So coming to our main topic, HPV vaccine, that is human papilloma virus vaccine. What exactly is it? It is an inactive vaccine which, given prophylactically, can protect a number of diseases caused by HPV. It prevents from getting from a HPV infection, thereby preventing you from getting genital warts, a number of cancers which I enlisted in the beginning. So how many types of vaccines are there? Basically, there are 3 different types of vaccine. One is Cervarix, which covers, as I told you, there are different strains, the low risk and the high risk strains. The high risk strains, which are notorious to cause cancers, some of them are 16, 18, 31, 33, 45, 52, 58. These are some of the strains. 14 high risk strains have been identified so far among the 200 varieties of HPV. So what we do is, the vaccine Cervarix, which was first released, used to cover only strains 16 and 18, and it was much higher compared to the newer vaccine Gardasil. So Cervarix was a bivalent vaccine. Now we prefer Gardasil because it's a quadrivalent vaccine which covers the strains 6, 11, 16 and 18, which can prevent genital warts as well as precancerous conditions which can lead into cancers later on. So that's a quadrivalent vaccine available in India from almost 2008, and most of us have been giving that. There's a new vaccine other than Gardasil, that's Gardasil 9, that covers almost 9 strains of high-risk HPV. In India, we have to think about the cost as well. The cost of Gardasil, plain Gardasil, is around 4,000 per shot. So you have to take at least 3 shots before the exposure to sexual activity, before the onset of sexual activity. Before the onset of sexual activity, only 2 doses are required, 1 dose today and 6 months away, 6 months apart. Once the onset of sexual activity, you need 3 doses. 3 doses in the sense 0, 1 to 2 months later, second dose, and 6 months later, the third dose. So that is a type of vaccine. There is a new thing which people they're still under trials. That is 11 valent vaccine. That is which can cover 11 strains of HPV, which is still not come to the market. Is still under trial. And one good thing is the government of India has released a vaccine called Sarvavac, which is available for the last 1 year. Considering the cost of the other vaccines which we import from the other countries. The cost of Servavac vaccine is around 2,600. So to be economical for the Indian people, it's around 2,600 per shot. So that is regarding the vaccines, 4 types of vaccines. Next, who all can take the vaccines? See, ideally, the preferred age for vaccine is around 9 to 14 years, especially 11 to 12 years. Both boys and girls have to be vaccinated. So, 9 to 14 years is the preferred age. It can be taken up to 26 years. Why 26 years? Why not later? Beyond 26 years, most of them would have got exposed to sexual activity. So, even then, up to 45 years, the vaccine can be given. The reason is, even in case a person is already exposed to a HPV virus, they need not be infected with all strains of the HPV virus. Maybe this vaccine can protect the other strains of virus. That is one thing. So HPV vaccine can be given earlier the better. So 9 to 14 years before the exposure to sexual activity, 2 doses of vaccine will give a protection of almost 98 to 100% lifelong protection against cervical cancer and genital warts. In case taken after 15 years of age or after the onset of sexual activity, the efficacy comes down slightly compared to before the onset of sexual activity. And what is the ideal age? I've just told the ideal age. And what are the side effects of the vaccine? Generally, this vaccine is an inactive vaccine. So, inactive vaccine will cause you the regular side effects of any other vaccine: redness, pain at the injection site, fever, pain, muscular pain. These are the only side effects, and no major side effects have been known so far, other than the hypersensitivity reaction which you can have for these vaccines. Next, then who cannot take this vaccine? There are few people who are allergic to yeast. Since this vaccine, HPV vaccine, is prepared through the process of yeast, getting yeast into it, people who are allergic to yeast or people who had a hypersensitivity reaction in the first dose should not take the vaccine. People who are pregnant and know they're pregnant need not take the vaccine when they're pregnant. And lastly, any acute severe infection, please don't take the vaccine. You can just take when you get better. Then, does insurance cover the cost of the vaccine? Yes, there are a lot of insurance companies who cover the cost of vaccine. Please check with your insurance provider and go for the vaccine. It provides you a lifetime, protection against a number of cancers. So it does cover. Next question, please. Okay, can people who are already sexually active take this vaccine? People who are already sexually active beyond 26 years of age till 45 years of age, as I said, can be taken, considering they may not be infected with one strain of vaccine. Can I get pregnant while taking the vaccines? If you've already taken 1 dose or 2 doses of the vaccine, yes, you can definitely get pregnant. There are no known studies which can harm pregnancy because of the vaccine. But once you're pregnant, you can discontinue taking the second dose or the third dose of vaccine, complete your pregnancy, and then you can take the next dose of vaccine and you can continue breastfeeding. It is not known to pass through the breast milk or affect the baby. So you can go ahead with the pregnancy, complete your pregnancy, and then take the further doses. What if I have taken other vaccines? See, as I told, HPV vaccine is an inactive vaccine. So you can go ahead and take any other vaccines at the same time as HPV vaccine. They do not have much interactions because it's an inactive vaccine. Generally, when you take a live vaccine with other vaccines, there can be interactions. So please go ahead and take the other vaccines along with the HPV vaccine. Next. Why is HPV vaccine not very popular? See, HPV vaccine is not very popular because two reasons. It could be because of us physicians, gynecologists. Second thing is because of the general public. Most of us, the gynecologists, have not made a good effort to explain to the patients regarding the condition, regarding the HPV virus, the symptoms, the complications, the incidence of cervical cancer, other cancers which it can lead to, the incidence of the cervical cancer, sorry, HPV infection in men, boys as well. So these things we have not put light on. We have not explained to the people. So we have to make an effort, and routinely we have to whoever patient comes, we should make an effort to explain to them regarding the condition, regarding the advantage of taking the vaccine prophylactically before the onset of sexual activity. And from the people said there are a number of people who come to the OPD when we advise them to take the vaccine, to get the vaccine to their children. They feel it is not required. They feel their children are too young. When they can take a pneumococcal vaccine, influenza vaccine, the parents feel they are those things the child can get anytime. This may look distant to them, the development of a cervical cancer or any other cancers or genital cancers, because they all happen after 30 years of age. So that could be one reason. Cost is another thing in India, because one shot of vaccine, which we are generally giving now, Gardasil, costs around 4,000 per shot. So that will totally come up to around 12 to 13,000. So that could be one of the reasons. So we have to put an effort from our side, being doctors, being gynecologists, to make them understand the awareness, creating an awareness regarding the HPV vaccine and the benefits. Next, is this vaccine included in government card for children? Anganwadi card, Thai card. No, this is not yet included in the Anganwadi card. But the government has been providing this at a much lesser price of 2,600. So it would be, compared to 4,000, you pay 2,600. That would be beneficial for them. So next one, somebody wants to know, can wearing a condom, because as I said, it's a sexually transmitted disease, can wearing a condom prevent HPV virus? See, HPV virus is basically caused by close skin-to-skin contact as well as sexual. So when you wear a condom, it can protect you to some extent, but the entire genital area is not covered by a condom. So it can protect you partially, but you still have a risk of contracting a HPV virus. So rather than thinking and worrying whether I get a HPV virus, as I said, it can affect almost everyone who encounters the sexual activity at some point of their time. Rather than worrying and thinking, it is always better to have a prophylactic vaccine before onset of sexual activity, or just do a screening method every 3 years with the pap smear test or a HPV testing every 5 years to make sure there is no abnormal cells. Then one of the routine practices which I have inculcated from one of my mentors is, whenever a patient delivers and comes for a follow-up at 6 weeks of pregnancy, I generally make it a point to sit with them, talk to them regarding the HPV virus, the diseases caused, the infections, the prophylactic vaccine, which they can take even then when they come at 6 weeks. Just get a pap smear done and take a vaccine, which can give them plenty of protection from these kind of diseases. Next. So HPV virus, there is the HPV virus, there is no treatment for the virus per se. In case if you have already infected with the virus, then there is no treatment for the HPV virus. We have to treat the condition. We can treat the genital warts. There is treatment for the genital warts. There is treatment for the cervical precancerous conditions for the cervical cancer. And one important thing which I want to stress upon, especially in India, is, see, we generally don't give much importance to boys' vaccination regarding these things. Please insist your boys, your children, to take the vaccine between 9 to 14 years before the onset of sexual activity, so that they can protect themselves, they can protect their partners from other kinds of cancers, especially head and neck cancers is more prevalent in men than women. Yeah. Any other queries? So somebody asked me regarding the age again. So the age is 9 to 14 years or 9 to 26 years ideally. Beyond that, even if they're infected with the HPV vaccine, HPV virus, in order to protect them from the other strains of the virus, we can give them the vaccine. 3 doses of vaccine, 0 dose, second dose after 1 or 2 months, and the last dose at 6 months. Okay. Thank you so much for your time, and please do make a honest effort to get your children or yourselves vaccinated with HPV vaccine to protect yourselves from numerous diseases and cancers which can happen when you're 35 to 55 years. Because it is globally increasing in India, it is drastically increasing. Please do make an effort. Thank you.